So we're going to be looking at the articulations of the shoulder complex. They're going to include the scapulothoracic, also known as the shoulder girdle, and that's going to be the scapula as it attaches to the thorax, including the acromioclavicular joints and the sternoclavicular joints, and then the glenohumeral joint, which is what everyone thinks of as the shoulder joint, is the other component to the shoulder complex. So what we'll see here is the picture that contains basically the whole thing. So the shoulder complex will include all of these pieces here, and again we'll break down the separate articulations. So the glenohumeral joint will be made up of the humerus and the glenoid fossa here, and then the scapulothoracic, and you can see it kind of shaded through here, is the scapula, and it's a posterior bone, but to the anterior is going to be the only bony connection, and that's going to be the sternoclavicular joint, so the clavicle as it attaches here, and then the acromioclavicular joint as the clavicle attaches to the acromion process. So the first one we'll look at is the sternoclavicular joint, and as you can see here, it's not a highly movable joint, so it's not one of our synovial joints, and it's very fibrous. It's a cartilaginous joint, so you can see the sternoclavicular ligaments and the costoclavicular ligaments. So remember that sterno means sternum and clavicular means clavicle. So that's going to be the soft tissue attachment to the sternum, and then we have the costoclavicular, costo meaning rib, so we have another support structure that's going to attach to this first rib here, and obviously we have one on both sides to attach to either side, the right and the left scapulothoracics. So the coracoclavicular, so this is the coracoid process here on the scapula. Again, the scapula is on the posterior aspect, but this actually projects to the anterior, and so it attaches and allows for ligamentous attachment to the clavicle. So it helps to hold that clavicle down because we've got musculature that attaches to that would essentially pull that up if it wasn't attached. In fact, we do see that when we have what are called AC joint separations or acromioclavicular. So this is the acromioclavicular joint here. So as we see the clavicle, and it attaches to the acromion process on the scapula here. So the posterior aspect is what we actually call the scapulothoracic. So this is looking at the back, and this is the posterior aspect of the scapula. So we see the inferior angle, the medial border, the superior angle, the spine of the scapula. So this posterior aspect is considered to be the scapulothoracic joint, or as it articulates with the thorax. So there's no ligamentous structures here. All you see is muscle attachments because it's considered a physiological joint, meaning that there's no joint capsule, there's no fibrous attachments or capsular attachments. There's only muscular attachments. So the only bony connection of this entire complex is again to the anterior to the sternum, and again that's going to be the attachment by the clavicle. So then as we look at the glenohumeral joint, so the glenohumeral joint is what most people consider to be the true shoulder joint. So that's going to be made up of the humerus. So you can see the head of the humerus here, and then the glenoid fossa here. So it's considered to be a ball and socket joint. So here's the ball, and here's the socket, obviously. So we'll look at another picture here in a moment, but that ball and socket joint gives us a whole lot of mobility. So it's considered to be one of the most mobile joints in the body. So this is looking at it from a lateral view, and this is a great view to give us all the structures that we really need to talk about. So this is the bony portion right here. So that's the glenoid fossa on the scapula, and then this outside layer is the glenoid labrum. So what that does is that's what helps to increase the depth of that dish, because that dish, it wasn't a very deep dish. It's relatively shallow, So there's not a whole lot of bony support there when it comes to that ball and socket joint. So this labrum provides some added depth to that, and then of course surrounded by musculature and ligamentous structures, we have a relatively enclosed capsule. A particular note here is to look at the long head of the bicep. So that's very unusual for a lot of muscles. Is it actually goes into the shoulder joint itself, the glenohumeral joint, and attaches to that supraglenoid tubercle. So the long head of the biceps is going to be an important muscle, and it's one of the soft tissue structures, kind of like the ligaments and capsules in the labrum here, that allow for overall support of this. So completely encapsulated, it's a synovial joint, so it's filled with fluid. So between the capsule, this labrum here, and the fluid, it creates a nice pressure that sucks the head of that humerus inside of that joint structure. So there's a passive support right there. And then of course when we look at all the musculature that also helps to support that, we'll see that that's also relatively important.